Did you know that the St. Charles County Ambulance District ran over 36,000 calls for service in 2015? With call volume up in O'Fallon and the county, it's more important than ever that these brave first responders have the latest equipment to better serve patients in emergency situations. We caught up with Battalion Chief Brandon Jones to find out how a couple of new devices are making paramedics' jobs faster and safer.
The hospitals are sending more people home on home health care, which allows you to go home on a ventilator, whether you're 4 days old or whether you're in the elderly age. And we're needing to have the training to be able to keep up with that demand for our service.
The St. Charles County Ambulance District is the largest in the state. In fact, there are 18 to 20 ambulances on the road at any given time. Recent advances in video technology have led to the development of video laryngoscopes as new intubation devices to assist in difficult airway management. The St. Charles County Ambulance District decided to add the McGrath video laryngoscope to their airway management tools. Introducing this new technology has several advantages.
We'll be able to confirm that we did see it past the vocal cords, and we are indeed 100% confirmed that we're in the right place without needing to take time to confirm that we're not. This is something that is able to be used on all size patients, and it's really going to make a difference in our day-to-day life here on the ambulance. What I'd like to do now is demonstrate how this would actually be done on a patient as we're in the back of the ambulance, our patient's on our stretcher, and we're headed to the hospital. We're going to use our new McGrath video laryngoscope. We're going to introduce the laryngoscope until we can see the cricoid rings. That's going to be our target for our endotracheal tube to be placed. We're going to watch the tube pass into the cords. As we pull the bougie tube out, we're going to make sure we're not pulling the endotracheal tube out of the trachea. We're going to inflate our cuff. We now have a 100% protected airway.
Also added into the mix of new technology is the Revel ventilator.
This ventilator is something that we've been needing for quite some time. It allows us to ventilate anyone from a newborn to the elderly. It has the capability of providing a lot of different pressures within the lungs that we weren't able to provide before with our ventilators that we had before on our trucks. We weren't really able to transport them on our ventilators and had to just go back to basics with a bag valve mask. This isn't good for the patient in a long-term stance because we're not able to keep all the VLI open, we're not able to recruit more VLI to open up and to help with that gas exchange.
You know, paramedics are put in situations where just a few minutes could mean the difference between life or death. And with the addition of the McGrath video laryngoscope and the Revel ventilator, lives can be saved faster than ever.
By training more, by getting new equipment, it helps make that life and death decision that needs to be made more comfortable for us to make it.